Okay, so if you've been dealing with pain that's been shooting down your leg, maybe it's numbness, tingling to your foot, or either into your hand, you may have already tried heat, stretching, pain meds, possibly even physical therapy, um, even injections. But the pain keeps coming back. I want to share with you exactly why that might be. Most likely it's from a bulging or a herniated disc. And it's not necessarily about the pain in your back. It's actually about the pressure that's being placed onto the nerves because the nerves connect everything. Now, my name is Dr. Al Simeone. I'm with the Disc Chiropractic, located here in Wheat Ridge, Colorado. Today, I want to help you understand what's really happening when you're experiencing symptoms like I've just described and how you can fix them without the need of surgery. So if you think about your spine and a spinal segment, the disc sits right between the two bones, and it acts like a spacer, creating that hole for that nerve to exit right there. You can think about this disc kind of like a sponge, and it can either get dehydrated, causing it to thin, or there can be pressure on it that causes part of the disc to actually bulge and herniate it out and end up touching and irritating that nerve right there. Um, Now, when that happens, that's when people experience symptoms that are typically traveling either into the leg or into the foot if it's coming from the lower back, or into the arm and into the hand if that bulging disc or herniated disc is coming from the neck or the top part of the spine. So it's not just a back problem, it's really a nerve communication problem. And your nerve system is really the operating system for the entire body. You think about it like the operating system for your phone or for your computer. And if that software is not operating properly, then none of the programs are going to run smoothly. So most people, when they're experiencing these types of symptoms, they start with rest, pain meds, or muscle relaxers. Maybe they've done physical therapy, massage therapy, acupuncture, or like I've mentioned, even injections. Now, the problem with those treatments is that it's solely focused on the symptom instead of on the structure. And it doesn't mean that the treatment itself has failed you or that you've failed the treatment, I should say. It means that the treatment itself just was not set up to focus on the structure that is causing the actual injury. And so, one of the biggest mistakes that I see people make is that they're using heat directly on the spine when the inflammation is already present. And so, that would just exacerbate the problem. Another common issue that I see is that people are putting ice on the leg or on the arm rather than where the injury actually is. So, one of the things that you want to make sure that you're doing is treating the structure that's causing the pain. So at the Disc Chiropractic, we always start with clarity. I want to make sure that we know exactly what's going on. And that's one of the reasons why we take a digital motion x-ray. If the injury is coming from the top part of the spine, we'd like to take a picture of the spine looking into flexion as well as extension, looking down and up. And if it's in the lower back, we like to have someone lean to the left and lean to the right. So we can see exactly what is moving when you're moving and what's not, because that's where the problem is. So we use specific analysis like a pending analysis to actually measure and quantify the issue rather than guessing with it. And so what we typically do is have a treatment recommendation that involves multiple treatments itself. One of the most important things that we can do for a disc bulge or a herniated disc is using spinal decompression therapy. And you can think about this therapy like a deep, deep stretch that gently pulls healthy fluid back into the disc, creating more space and opening up that hole right there for the nerve to exit, unpinching the nerve. Now, spinal decompression it will also allow the spine to relax and push the old fluid out, which is important because that has toxins in it, which over time will break down the disc. So spinal decompression will stretch and pull healthy fluid in and push the old fluid out, which is very, very important because that prevents the progression of spinal degeneration. Another form of treatment that we use for a disc herniation or disc bulge is precise chiropractic adjustments. We want to restore proper alignment and motion to the spine. That way it can function the way that it's meant to. And then a third core pillar of treating a spinal disc injury is going to be therapeutic exercises. We want to make sure that you understand the proper stretches and exercises that you should be using to stabilize and strengthen the spine once the pain has been resolved and is calmed. Now, there are other treatments that we do in addition. When appropriate, we use therapies like shockwave therapy to help melt any of the damaged soft tissue. And it will help stimulate more blood flow to the soft tissues as well, along with even stem cells. So the stem cells will get in there also and to help restart the healing process. So we like to evaluate, correct, restore, and then strengthen the spine when someone's dealing with a spinal disc injury. Now, I do want to share a story with you about one of our patients, a 43-year-old male who's an electrician. Now, he came into us with searing back pain that was traveling down his leg, all the way down to his left ankle. And he had tried everything. He had tried oxycodone, he had tried massage therapy, physical therapy. He was using ice, but the pain was just getting worse and worse. And he had came into our office with a 10 out of 10 pain. And we got him started with treatment, and after a few weeks of spinal decompression, chiropractic adjustments, getting him into therapeutic exercises, his pain was starting to ease. And by the end of treatment, he reported 100% improvement of his symptoms. No more burning, no more daily pain. And currently, he only feels mild tightness if he's up on a ladder, especially when he's looking up, which is really an incredible improvement when you consider where he first started. So when you see someone go from feeling hopeless due to their pain back to getting on their feet and being able to do the things that they really need to do and want to do, it's a very clear reminder of how resilient the body actually is when you give it what it needs and you give it the right environment to heal. So I want to make sure that you understand that if you've been told that this is something that you just have to live with, and that is not true anymore. Bulging discs, they are progressive, right? They can dehydrate and degenerate further if they're left untreated. And the longer that a nerve stays irritated, the harder that it is to heal and to reverse that. But there is good news, right? With the right treatment, most people start experiencing an improvement of their symptoms within 2 to 3 months. And that's what we've personally seen in our office. Many, many cases can see significant amount of improvement with the right treatment. So the question isn't whether you can heal, it's whether you'll take the first step to begin that healing process before it starts to worsen. So if you're ready to find the real cause of your pain and to start healing, what we're offering is an opportunity to come into the office to get quality information about your health so that you can make a quality decision about how to treat it, whether that is with us or with somebody else. And so what we offer is a new patient consultation, which includes an exam, consultation, any necessary x-rays, as well as a personal report of your health findings for only $47. And we're offering that because the longer that discs and disc injuries go untreated, the more it dehydrates and compresses the nerve. And that makes recovery much, much slower. So my goal is to help you get ahead of that. So all that you have to do is click the link below or the QR code on your screen to schedule that visit, or feel free to give us a phone call. You can reach us at 720-573-4910. And someone on our staff will be happy to answer any questions that you have, any concerns that you have as well. So whether you come into our office or not, I hope that this information gives you some clarity about what's happening inside of your spine, as well as the confidence to know that recovery is possible. Again, these discs, they are living tissue and they can heal when we reduce the pressure, restore movement, and re-educate the body. So I just want to leave you with that and thank you for enjoying this video. And I do hope to meet you at the next perfect time.